Have you ever wondered how growing up with narcissistic parents might affect a person's life? Let's take a closer look. When a child grows up with a narcissistic parent, they may experience a multitude of psychological and emotional impacts. The self-centered nature of a narcissistic parent can lead to a child feeling unseen, unheard, and unimportant. They may develop low self-esteem, believing that their feelings and needs are secondary or even irrelevant. This can create difficulties in forming healthy relationships, as they may not understand what a balanced, reciprocal relationship looks like. Emotional difficulties are also common, with feelings of guilt, shame, and confusion often dominating their emotional landscape. They may struggle with expressing and managing their emotions, leading to further challenges in their relationships and personal life. These are just a few examples of the profound impact parental narcissism can have. Now, we are going to delve into the role of therapy in addressing these impacts. We have with us a licensed therapist to help us understand how therapy can aid victims of parental narcissism. You see, therapy can be a lifeboat in the tumultuous seas of narcissistic parenting. It serves as a safe harbor, a place where individuals can explore their feelings, process their experiences, and begin the journey towards healing. There are several therapeutic approaches that have proven effective. Cognitive behavioral therapy, for instance, can help individuals recognize and challenge negative thought patterns that have resulted from living with narcissistic parents. Psychoeducation, another pivotal aspect of therapy, aids in understanding narcissism and its impacts better. This knowledge can be empowering, helping individuals to make sense of their past and to navigate their present more effectively. Eye movement desensitization and reprocessing, or EMDR, is another therapeutic modality that's been found to be beneficial. It's a unique method that can help individuals process traumatic memories and reduce their ongoing psychological impact. But beyond these specific approaches, the therapeutic relationship itself is crucial. A supportive, empathetic therapist can provide the validation that many victims of narcissistic parenting have been denied. This validation can be incredibly healing. It's the affirmation that it's not your fault, that your feelings matter, and that you are worthy of respect and love. Moreover, therapy provides a safe environment where individuals can express their feelings without fear of judgment or reprisal. This freedom to express and explore emotions is often a stark contrast to the stifling atmosphere of a narcissistic household, where feelings are often dismissed or invalidated. Finally, therapy can help individuals develop healthier coping mechanisms. Rather than resorting to the maladaptive strategies they might have learned in their narcissistic environment, individuals can learn and practice healthier ways of dealing with stress and adversity. To sum it all up, therapy, in its various forms, can be a powerful tool for individuals affected by parental narcissism. It offers a path towards understanding, healing, and growth. It's not an easy journey, but it's one that's worth taking. Therapy can indeed play a significant role, but how do therapists understand and validate these unique experiences? Understanding a client's experiences is a crucial part of therapy. How do therapists achieve this understanding? Well, it's a multifaceted process. Therapists employ active listening, allowing clients to express their thoughts and feelings without fear of judgment or criticism. This open dialogue creates a safe space for clients to share their stories, their pains, and their triumphs. Therapists also use empathetic understanding, putting themselves in the client's shoes to truly comprehend their emotions and experiences. They validate these experiences, affirming the client's feelings without dismissing or minimizing them. This validation is key in helping individuals affected by parental narcissism, as it reassures them that their feelings are real, valid, and important. This understanding and validation are fundamental to the therapeutic process. They help therapists tailor their approach to suit each client's unique needs and experiences, facilitating a more effective and personalized therapy. Therapists are indeed prepared to handle the complexities of narcissistic abuse, but can they help in establishing healthy boundaries? Let's delve into this in the next scene. Boundaries are crucial for victims of narcissistic abuse. Can therapy assist in this area? Indeed, it can and it does. Establishing boundaries is a critical step in healing from the toxic influence of narcissistic parents. Therapy provides a supportive space for individuals to learn about and practice setting these boundaries. Therapists can guide individuals in identifying what feels safe and comfortable for them, helping them define their personal boundaries. They can also assist in articulating these boundaries to their narcissistic parents, something that can be incredibly challenging given the power dynamics at play. Moreover, therapy can help individuals maintain these boundaries over time. This involves learning to resist manipulation tactics and guilt trips, which are often used by narcissistic parents to overstep boundaries. Through this, therapy can empower individuals to protect their mental and emotional well-being, creating a buffer against the harmful effects of narcissistic abuse. Setting boundaries is just one part of the puzzle. Rebuilding self-esteem is another significant aspect. Self-esteem and self-worth often take a hit when one grows up with narcissistic parents. Can therapy address this issue? Indeed it can. Therapy provides a safe space to explore and challenge the negative beliefs about self that may have been instilled by narcissistic parents. Therapists often use cognitive behavioral therapy, or CBT, to help individuals identify and challenge these negative self-beliefs. This therapeutic approach encourages individuals to replace these harmful thoughts with more positive, realistic images of themselves. It's not just about altering thought patterns, though. It's about fostering self-compassion, too. This process involves recognizing your worth and acknowledging that you're deserving of love, respect, and kindness, just like everyone else. Therapists may use mindfulness-based techniques to help individuals develop this self-compassion. These techniques encourage individuals to be present, to be aware of their feelings without judgment, and to treat themselves with kindness and understanding. Therapists also encourage individuals to explore their strengths and achievements. This exploration can help to build a stronger sense of self and to counteract the negative self-image that can result from narcissistic parenting. It's about recognizing the resilience that has been developed, the challenges that have been overcome, and the personal qualities that make each individual unique and valuable. Equally important in the therapeutic process is the establishment of healthy boundaries. This means learning to say no, to recognize and respect personal needs, and to stand up for oneself. It's about reclaiming personal power and taking control of one's life. Now, rebuilding self-esteem is not an overnight process. It requires time, patience, and commitment. But with the right therapeutic support, individuals can start to see themselves in a more positive light, to value their worth, and to build a stronger, healthier sense of self. So yes, therapy can indeed help in rebuilding self-esteem. But what about navigating relationships with narcissistic parents? Managing relationships with narcissistic parents can be challenging. Can therapy provide support here? It surely can, and here's how. Therapists, equipped with an understanding of the dynamics of narcissistic parenting, can guide individuals in navigating these complex relationships. They work with their clients to identify patterns of interaction that may be harmful, and develop strategies to manage these situations more effectively. Therapists can also assist in determining when it might be necessary to limit contact with a narcissistic parent. This is a difficult decision to make, but sometimes it's the best course of action for the individual's mental health. Furthermore, therapy can help individuals learn how to communicate their boundaries effectively. This is crucial in any relationship, but especially so when dealing with narcissistic parents. So, yes, therapy can indeed support clients in this area. But can it help break the cycle of dysfunctional behaviors learned from narcissistic parents? Can therapy help victims of parental narcissism break the cycle of dysfunctional behaviors? This is a key question that many people grapple with. The answer is a resounding yes. Therapists work diligently with their clients to identify maladaptive behaviors, those unhelpful actions that were developed as coping mechanisms during their formative years spent with narcissistic parents. Once these behaviors are recognized, the real work begins. Therapy is a process, a journey toward understanding and change. It involves unraveling the patterns of the past and replacing them with healthier habits and responses. Therapists guide their clients through this journey, providing them with the tools and strategies they need to break free from the shackles of their past. This process is not easy, nor is it quick. It requires dedication, patience, and a willingness to confront one's past. But with time and perseverance, individuals can unlearn the dysfunctional behaviors ingrained by narcissistic parents and start a new chapter of their lives. Indeed, therapy can play a crucial role in breaking the cycle, but how long does it typically take to see positive effects? Therapy is a process and it takes time, but how long does it typically take for victims of parental narcissism to see positive effects? The answer to this isn't as straightforward as we might like because the timeline for therapeutic progress is as unique as the individuals seeking help. Some people might start to feel better after a few sessions, while others might need several months or even years to fully process their experiences and heal. The duration of therapy can be influenced by a variety of factors, including the severity of the narcissistic abuse, the individual's resilience, the quality of the therapeutic relationship, and the person's commitment to the therapy process. It's crucial to remember that progress might not always be linear, and there can be setbacks along the way, but with patience, commitment, and the right therapeutic support, it is entirely possible to overcome the effects of parental narcissism. In conclusion, therapy can be a powerful tool for victims of parental narcissism, helping them navigate their experiences, establish boundaries, rebuild self-esteem, and break the cycle of dysfunctional behaviors.